Hi, I'm Penny Cowan.
And I'm Dr. Anita Gupta.
And we're here with Health Power for Minorities. And you have some questions for us. So the first question is, what is the purpose of the survey, Understanding America's Pain? And the purpose of that was really to understand people's attitudes towards pain and what they do about it. So we surveyed, or IROCA funded a survey, and they surveyed 1,000 people to really understand, what is their understanding of pain. And what we found out is that 8 out of 10 people experience some form of pain. But about 50% of those still are experiencing pain on a weekly basis. So what did I find? What were the results that were surprising to me? I think what was the most surprising is that 1/3 of the people ignore their pain. You would think that most people, really are always complaining about their pain, but 1/3 of the people are ignoring their pain. And only 31% of the people that we surveyed actually feel like they're getting any kind of relief from their pain. And yet, 60% of those really don't even talk to their healthcare providers about, what are all my options? What can I do around pain and pain management? So I think that was really surprising to me.
So let's move on to another question. Why is it important to understand the risks of taking non-steroidal anti-inflammatory drugs? Well, it's really important. NSAIDs can be very effective if taken appropriately. The FDA actually recommends that you take the lowest dose for the shortest duration of time. And 27% of people surveyed actually did not know that. Over 123 million prescriptions of NSAIDs were prescribed last year, and 1/3 of individuals are taking over-the-counter medications. So critically important that individuals understand the risks that are involved with taking NSAIDs, which can include heart attack, stroke, kidney disease, and also bleeding in the stomach. So talk to your doctor about those options so you can avoid some of those risks. What else did the survey show? Well, the survey showed a lot of information, and one of the most impressive was really that people are not talking about their pain. Almost 60% of individuals are not discussing their pain management to their doctor. If you don't talk to your doctor about your pain, you're not going to get the safest, most effective treatments. You're not going to understand what options exist. It's so critically important so that you have a comprehensive regimen available to you. And last question is, why is it important to talk to your doctor about pain management? Penny?
Yeah, and I think that one is really important because most people think, the doctor's just going to give me something, I'm going to go home and take it, and I'm going to be good. But actually, when we talk to our healthcare providers, we need to ask, what are all my options? Not just what medication you can give me, but what are the other options that you can provide, whether it's maybe stress management, maybe it's acupuncture, physical therapy, maybe some injections, maybe, But also, what can I do? What is my responsibility in actually managing my pain? What can I do to live with my pain from day to day? And that is really important because we can no longer be passive patients. We have to become active participants. There's a lot of talk around patient-centered care, but that doesn't mean that you're supposed to be at the center and sit there and do nothing. It means that you have to be an active participant in that health care and really find out what are all the other modalities. And there's a lot of self-management skills that can work. Yeah. But again, I think it's really important to talk to your doctor to find out what the best treatment is for you.
Great, and I think there is a lot of information out there available on how to treat your pain. I know the American Society of Anesthesiology, the FDA, and the American Chronic Pain Association has a wealth of information, but again, the most important source of information is talking to your doctor, talking to your pharmacist, and including your family members in that discussion.
Yeah. Thank you for having us.
Thank you.